I think AI is exponential, and then it was like slowly gets deployed, and then it's like Amazon is everything, and you go up this. And I think the same will hold true. It might even be a sharper exponential curve for AI.
Welcome back, everyone, to another episode of the Brainiac Blueprint, where we discuss the intersection of AI and real-world applications with our esteemed guests. I am Kyle Lambert, founder of Left Brain AI and Action Hero Marketing. Today's episode is another one, a part of our healthcare series. Our discussion is going to be focused on scaling and improving efficiencies from a healthcare operations perspective. With that being said, today's Brainiac is Will Hayes. Will, welcome to the show.
Thank you, Kyle. Brainiac. All right. I think it's the first time I've ever been called that in an introduction, so I appreciate it.
Hey, you've got a wealth of knowledge and insights to share with us. That's why you're here. So,
Right on. Well, yeah, excited to be here. I appreciate you reaching out and excited.
Awesome. Well, Will, I know that you are your title is growth manager at Third Way Health. So, if you wouldn't mind, share a little bit about yourself, what you're doing at Third Way, your experience, all that kind of stuff to give our audience a little picture about who you are.
Sure thing. So, yes, Will Hayes. I'm a growth manager here at Third Way Health. Been with Third Way for 2 years. It moved me from the Midwest to Los Angeles, and it's been a great experience here at our headquarters. Joining a young company that I think is doing some really exciting things, and I'm excited to be a part of it. Third Way Health, we are an healthcare operations partner. Sounds super broad. Essentially, you could think of us as we serve two different types of organizations in the healthcare industry. So you have your payers, like your insurance companies, and then your providers, medical practices, and health systems. And then as growth manager, I lead anything that has to do with us kind of growing our organization and growing the name of Third Way Health to get both sides to be able to learn about Third Way, what we're doing, why this company was built, and the impact that we're having.
Very cool. Very cool. Thank you for that. I know we're going to be diving into Third Way a little bit more and, all the cool stuff that's going on there. But before we do, as you know, all of our guests will complete a prompt for me. It helps to set the stage. So I was hoping you would be able to do that. So let everybody know, I think AI is.
I think AI is exponential. By exponential, I think it is a very important framing for how people view AI. So let's take the internet, for example. If people thought maybe it might be very linear how the internet was going to impact everyone's day-to-day lives, businesses, looking back, we can all see it was very exponential, and that people were working on the internet, building the World Wide Web for a long time, and then it was like slowly gets deployed, and then it's like Amazon is everything, and you go up this. And I think the same will hold true. It might even be a sharper exponential curve for AI.
Very cool. Exponential is a great word. I think that perfectly paints the picture, and you're right. I definitely can see the acceleration curve becoming even more and more steep because it compounds on itself, right? It just gets better and learns more. So very interesting perspective there. I appreciate that. So let's jump into Third Way. So, we connected earlier and you painted a picture about how Third Way partners and helps with different actions that are, basically helping the operations perspective. So anything that's outside of the actual office, you guys will help facilitate and make it a little bit smoother. So can you just kind of elaborate a little bit more as to what healthcare operations means and what you guys are really trying to accomplish?
Yeah. So I'll go with I'd say kind of our core offering is to be a medical practices front office partner. By that, let's first paint kind of the current state of a medical practices front office. So I think I know I've experienced it. I'm curious if you have too, Kyle. Trying to call in to schedule a doctor's appointment. How has that experience been for you?
It can be frustrating. I typically try to use an online scheduler if I can, but I just find that to be more efficient, healthcare or not, just trying to get a book. So Yeah, I typically default to the calendar on the website if possible.
Yeah. So, there are many organizations that don't have online self scheduling. Some may have it, but then you might get a call back that it wasn't actually accurately scheduled. And actually, many people, even with all the online self scheduling, all these surveys still show in 2025, majority of people still like to call in to schedule their appointment and then call in for all variety of reasons. Could be billing, could be their insurance verification, could be they left their jacket at the doctor's office. And for many people, they wait on hold for maybe 20 minutes to talk to someone. And then often, if they do get to talk to someone, they don't get their question or their requests resolved. So the idea of third way health is, hey, if you work with us, your front office, instead of having to handle all of those phone calls and that long line of people waiting to be answered on the phone and the long line of people in front of you checking into their appointments or checking out, you only need to worry about that line of people in front of you that you need to interact with. Third way would then virtually handle all of the calls, the appointment scheduling, your insurance verification, any appointment reminders, or calling people who no showed or maybe canceled to get them rescheduled. And so it makes it easy for the front desk to just worry about in-person interactions. And then third way can take care of the rest. Hopefully make it a great experience for the patient to just call in and quickly have their phone call answered and resolved.
That's incredible. I think healthcare in general is stressful. A lot of times you're going because there's something wrong, and having to figure out, scheduling and make sure it's done right and everything is just, you don't want to be thinking about that, right? It's just, let me get in there and get my prescription or diagnosis or whatever it is. So
Right.
it's great to be able to make that process easier. And for me, the picture really got painted for one of your LinkedIn posts. I shared it with you. I thought it was very interesting. You guys had analyzed different times of day and day of the week and how it was scheduled. And you saw some clear trends that can dictate how offices can just better schedule and better plan and things like that. I'm hoping you can elaborate a little bit with our audience, because again, I found it to be very useful and interesting to see the data come together like that.
Yeah. So we handle millions of calls for medical practices. So a really cool part of that is to analyze different trends. And so we put it together. And this one is specifically focused on no shows. So we're like, can a practice plan on, 1 and 3 patients are going to no show here? We could get away with double booking because more than likely one of 3 people is not going to show, and we'd be able to see them both. And then also trying to figure out when it makes sense for doctors to offer appointments versus when it doesn't. And then we also look for the difference between in-person appointments and telehealth appointments. So across both in-person and telehealth, it seems everybody shows up to their early morning ones. If you schedule an appointment, start of the day, you kick that off, and then work understands if you get there later. Lunchtime was a really interesting one. It was for in-person appointments, people are going to show up. It was like very consistent. But telehealth, you'd have people no show a lot. So I don't know if it was they just said they could just work through lunch, or maybe lunchtime transportation for a lot of people. With telehealth that wouldn't be the case. So it was kind of a peculiar one there for telehealth. And then in the evening, or like getting in the late afternoon, very stark difference between offering 4 p.m. appointments versus 5 p.m. So it's like some doctors choosing to stay a little bit after typical working hours of 5 p.m. It was actually, I think it was 20% and close to 30% of people end up not showing. So these doctors would extend their hours to see more patients, and then for whatever reason, people then couldn't make it. And it's very unreliable that people would show up. So just kind of interesting aspects as to when would people show up, when they wouldn't.
I think data like this is so cool from a storytelling aspect. It really dives into just the human element. You're making these assumptions, like you said, maybe it's transportation, maybe it's at the end of the day, they're just burnt out and don't feel like having to worry about another thing. But it provides a very clear action plan of how you can, again, be more efficient and or grow your revenue, because you can double book and things like that. It's a very cool system. And I assume that there's a lot of data like that organizations are going to be finding useful tenfold time,
Right.
exponentially, to use your own word. So
Right. Right.
Awesome. Awesome. So, I want to dive in a little bit more to AI in healthcare operations today. Obviously, you guys are AI based and you're helping to improve a lot of systems. Where, from just your own opinion, do you think AI is the most impactful today from a healthcare operations standpoint? Is it something like scheduling or documentation? Maybe it's intake. Where do you think, like right now as it stands, it's having the biggest impact?
Yeah, great question. And healthcare operations is super broad, so I'll speak more to maybe our front office
Sure,
operations
sure,
application. And actually, this one I think is not maybe what catches people's eyes a lot, but the really big impact has been AI quality assurance. So instead of relying on humans to, it's basically impossible to have an entire team listening to every call that's happening each day and making sure the script or making sure that the questions are resolved and the right questions are being asked, and then being able to train your team and make sure patients are being taken care of the right way. You'd have to completely double staff an entire organization if you had everybody listening to every call, reviewing them. So for most organizations, it might be 5%, 10% you're able to review. But with AI, you can review 100% of calls and it can score them. You can create custom scorecards on specific checkpoints that you want to make sure. Let's say like a call center representative is making sure they ask a certain question, or if they answer a certain way, or if a patient answers a certain way, then they ask the next question. So that's been a very large impact. Um, and then I would say next would just be the accuracy of being able to schedule appointments. Again, I think a lot of AI that gets talked about is the voice AI. Even now, you can talk to ChatGPT back and forth, and of course, that's an application that people can have. But for a lot of it, is wanting to make sure that patients are accurately scheduled, so that when they do show up to their appointment, they're not waiting in line. They have six people in front of them, and they're upset, and doctors are upset. And making sure that if they do get seen for an appointment, they don't get a surprise bill in the mail because AI was in the background making sure their insurance was verified before being seen. So if they're seeing a doctor, they know their insurance is covering, and they're not surprised with a large out-of-pocket bill later.
that's such great applications. Again, it's just making the patient experience simpler, easier. You're able to cater to them and provide solutions. It's such a no-brainer to me. It's probably not something that a lot of people think about, but it makes absolutely perfect sense. I'm curious though. So you guys are currently at a hybrid model, right? So I was doing some research. I saw it
Mhm.
was something like 86% of organizations are using in healthcare are using AI today. 94% see it as a core of their operation. So there's a lot that have already dove in and are using it. You guys have this, it seems like an AI plus human approach. So I'm
Mhm.
curious as to why not go full AI. Do you expect there ever to be a doctor's office that there's literally no staff other than the doctor and the whole thing is AI? I'm curious as to how you see it and maybe why, Third Way is just leaning into this AI plus human approach right now.
I'll never say never. Maybe there'll be some people that enjoy that. I think that's far off, and I think the majority of people still very much like interacting with humans. And I think AI, still as it is, it is still a tool right now. It's still a tool that is wielded by humans, and so it's a piece of the puzzle. So I'll kind of take it back to the inception of Third Way a few years back. So our CEO, he had worked for healthcare consulting companies, and then he also worked for Salesforce and for Clara, a couple big tech organizations as well. Basically saw, these technology platforms could really be useful, could really help a team, but if the companies that I'm then working with aren't adopting it, or it's not being updated based on their doctor's preferences, it's not useful. It's still going to make mistakes, and so you need people to be able to make it right. And then our COO, he came from a background of working at EY, where he would build these global shared service centers, where you have these teams of, all centralized in one place, focused on one aspect of being able to serve an organization. So I think being able to blend those together and say, hey, we will offer you this technology that is awesome, and it can be tailored to your organization. But when it maybe not necessarily fails, but when it falls short or you need someone to be able to manage it, we have a team for that as well. And then I'd say for a real life example of how that looks like for us is we have what we call our Dino AI. So that's our voice AI that you can talk to. So yeah, you may call into a practice and you want to you want to change your appointment time from 9 a.m. to 3 p.m. See if that's possible at your appointment 3 weeks out. Well, you're first going to interact with Dino, and Dino is likely to be able to make that change. But let's say you have a much more complicated question. You want to ask something that has to do like, oh, I didn't mention something about my shoulder that I come in to be seen, and I had a question about this. Well, then Dino will escalate that to a human. If you are, let's say, implementing an AI point solution, you just kind of have that Dino, and then your Dino says, yeah, I'm going to escalate that to a human, and a human will be there to be able to serve you. And then someone falls into waiting 20 minutes on the phone, just like before ever working with Third Way. It really doesn't solve anything. But if you have Dino be able to talk to them, escalate to human, and then a human pick up that call and resolve the complex cases, that's the ideal case where you can be adopting both technology and still have that human touch to be engaging with people.
Human power empowerment. You're singing my favorite tune here. That sounds incredible, and honestly, it sounds like it sells itself. So I'm curious as the growth manager there, do you get a lot of pushback? What are some grievances or worries that these people typically have when you're talking to them about how you can improve their operations, or is it just like, here's a document, look at these numbers, you're going to get exponential growth or whatever it is? What's that process look like for you?
Yeah, I don't think, Kyle, it's too much of like, let me send an email and then in 2 weeks we're handling calls for their practices. That'd be nice, but also probably anybody could do my job in the company. No, of course you get some pushback because the reality is what we're doing is still interacting with their patients and we're scheduling for their doctors. That's like one of those high touch things and high trust things that an organization is doing. So I think it's so pushback you first get is just like, who are you guys in general? Let's first get to know you. You need to know someone, you need to trust that you know what you're talking about before you would want to work with someone. And then second, like if you want to kind of get down into the details of like the AI versus outsourcing and being able to have someone handle your calls. Some people they might be interested in AI. Oh, I want to see AI be able to take all the calls and be able to do everything. It looks like AI is exponential. Look how much it's growing, how much it's able to do. Read these other articles. What's been very interesting is just in the past month or two, having several conversations with people who we talked to months back and go, oh, we want to try AI. We want to see what's going on with AI. And then they call back and go, oh, actually AI is falling short, or it was a lot more internally that we're constantly having to update and manage the AI bot. We would rather just have someone be able to do that for ourselves. And we have like an AI partner, but also is being able to solve the current problems we're having. So it's been really interesting of recent. And then it's like, yeah, since we've last talked, we've incorporated more AI into our service, but of course still have our human team. I think I'd be interested in, I know this space, I know the healthcare front office space. I'd be interested in other spaces where people have tried AI and companies have been adopting AI and then find, wait, it's not perfect yet. We still need to be working with a team that basically knows how to manage the AI as a service and still like they can still take that burden. I can just check in on them and they can let me know what they're doing instead of me internally. Just like any other old software, I'm sold on the shiny object of the software, but then I have to try to manage it and make it work, and it falls short of all the promises.
It's funny. I have a very similar experience just from a marketing standpoint. I'll talk to some people and then be like, okay, yep, this makes sense. I'm going to run some ads myself. And it's like, inevitably, you're going to fail and you just burned $5,000 or whatever it is. But unfortunately, you got to let that happen sometimes for them to realize, okay, it is worth having an expert like you who's going to come in and handle this stuff. So interesting that you're running into a similar situations there. I'm curious if you've noticed from a kind of a sales standpoint, if there's any trends that you've noticed kind of comparing different potential clients. So for example, maybe it's a small local clinic versus a large hospital system or something like that. Have you seen any trends that pop up, or maybe this organization cares about X more than Y? And I'm
Mm.
curious how that all shakes out.
Yeah. So I think any organization and selling at all, referrals are always going to be kind of top dog. And I think healthcare specifically referrals are so much. And that's because it comes down to being such a high trust industry. And then specifically what we're doing and interacting with the patients, even more high trust. So referrals, have really reigned king. And because of that, especially as a young organization, you put a lot of time and attention to, if we're working with someone, then let's do an excellent job. And that takes priority first. And then getting your name out, getting marketing out is going to be a bit behind that, because uh, servicing your current customers and doing right by them is going to have a ripple effect. And then, yeah, I would say, some that are independently owned and smaller medical practices are going to be able to move faster than some larger health systems. Um, Specifically on this sales side, that there are different organizations you might work with. So they might have that picture of the front desk answering calls and trying to get things done and managing people. Or they might already have an internal call center set up and they kind of already have that model where the front desk is taking care of it. But running their internal call center is really hard. We hear all the time, ever since COVID, it's been really hard to staff a call center and find people that are reliably do a good job for whatever reason. Still kind of looking at like the specific reason for that. Or they may say, hey, we work with an external call center already and we're not happy with that service. So just kind of the different organizations, like where they currently are handling calls in front office, that they're going to have different sales processes.
100%. Yeah. I mean, there's always going to be some little customization or unique perspective that you have to address. I guess that's just part of the game, right?
Yeah.
So yeah, I want to jump in a little bit more in terms of your role and kind of marry that in with AI. When you and I originally spoke, you had discussed AI BDRs and making sure that you're incorporating the human touch still. So I'm curious as to what your outbound strategy looks like and how much of that you're automating it, and kind of like how you make sure you're still getting the message across that you want to.
Yeah. So great question. And I would say a lot of the automation is done for equipping and enabling our BDRs. But I'm a big proponent, at least thus far, of the human BDR and the human touch there. Actually, doing things that are very non-scalable first, finding what works, and then doubling down on that. That's very much been our approach. We worked with another vendor that can do things and automate and send with your alias and come up with custom messaging that gets AI attention. And I think for some people it can work. I found thus far it's as personal and even as conversational as you can get. You grow up like, write a very professional email, and especially if you're writing to somebody like I'm writing to a COO, you would want to be like very formal. When in reality, it's everybody's on their phone and they're just looking at their emails and they're looking at the quick. So sometimes it's like a 1 or 2 line text message where you say, "Hey, I spoke with Tracy. She shared this, and we do this. Thought it'd be interesting, and that might work."
Yeah.
So it's interesting, but still, of course, there are success stories of people out there of adopting AI, and I'm always kind of all ears to see. Okay, we're going to keep doubling down on this, but we've left this percentage of room to try new channels and try new strategies, and maybe let's send some automation and see if that might work. Take some workload off from us.
Yeah, it's so cool to kind of see certain things work that you just totally don't expect. But it makes sense from a C-suite person, like in the example that you gave. They don't have a lot of time, right? They're not going to be opening up a message from some person they've never met before and reading 5 paragraphs in an email. That's just completely unrealistic to think about. So it's great how you can play around, adjust your prompts maybe, and get a some output that's going to work, or at least give you the same shot to work.
Yeah, definitely.
Very cool. What is your kind of channel mix right now? Are you focusing mainly on outreach through email, or is there do you guys have ads and content going? What I'm curious as to what's been working for you so far from a channel.
Yeah, so we really haven't, not a lot of ads. We do some content like the LinkedIn post that you shared. We do put out content. So I think we have some from our analyzing our data, or maybe talking about customer stories. I personally have done, I like to do video series. So if we get out to a
Very
conference or
cool.
interact with other people, I like to do the interviews and just kind of see what people are doing. One, I think it's fun. Like, people go on LinkedIn to be entertained. So I try to provide some entertainment. Um, and but that necessarily hasn't like brought in all of the intro calls. It's just kind of a way to be engaged with people. I think LinkedIn is a great place to be, to share some content. But to answer your question of channel wise, it's still the tried and true emails, calls, maybe some LinkedIn messages that are going to get through. Anybody says cold calling is dead, they haven't been doing it themselves, or maybe haven't been doing it correctly. Or same
Yeah.
with cold emails. Cold emails, they're tougher. Now Google like summarizes all of the emails, and trying to figure out if you're even landing in spam is a whole job itself. Getting software, make sure that your emails are getting to the primary inbox, and then yeah, creatively engaging people. I spoke about like doing things that are not scalable and then doubling down on what works. uh, I'm kind of sharing a little bit of secret here, but I've shared it with other sellers that can adopt it. I'm a big fan of the whiteboard, and incorporating some pictures. So funny enough, just writing somebody's logo on a whiteboard, taking a picture of yourself and sending it either like in email or on LinkedIn can really work. So here we go. This would be me. I might send you a follow up and then write like,
Nice.
hey, thanks for the podcast, Kyle. So big advocate for this, and even like you cold outbound to me. Cold email's not dead. If you need to kind of get somebody's attention, especially if they're like, yeah, I would love to meet, and then they kind of ghost you for a week or two, try the old whiteboard. Let me know if it works for you.
I like that. I like that. That's an easy way to kind of personalize, show you did some work and things like that. That's very cool. Very cool. Great
Yeah.
drawing. I didn't know you had such some artistic abilities like that.
Oh, it's just tracing. I can't come up with a bunch of my own and make it look pretty.
That's awesome. I think we got the perfect thumbnail right there for our
Yeah,
video.
nice.
Awesome, awesome. Well, cool. So I want to keep going on some AI topics here for us to discuss. So with AI, there's always a little bit of fear and doubt that comes with it, especially from certain people who aren't as involved or up to date in how it can be used. But of course, there's an extra level of it when it comes to healthcare, making sure that we're staying HIPAA compliant and we're not sharing
Mhm,
personally PII. There we go. Couldn't get
mhm.
that out for a second. So I'm curious as to how you think about it, how you try to balance innovation with safety and trust. I'm sure Third Way has a million built-in things to either anonymize or delete data and things like that. So I'm just curious as to how that all fits into your ecosystem.
Yeah, I think that has to be number one for anybody in healthcare. So, of course, we have a product team, security team, IT team that handles all of that. I put my trust in them. A lot of trialing and building things and testing it internally, or testing it in a test environment before going live with it. Um, I think are the primary ways to ensure HIPAA compliant. And I touched earlier on like on the AI quality assurance. That's very much driving. Um, why it's something we're most excited about. And I think it maybe doesn't get a lot of the attention of the shiny object like talk to an AI, but it's like this is actually a huge impact. We can make sure we can score everything. We can make sure that each call is HIPAA compliant and really flag it if something pops up that shouldn't have occurred.
It's such an interesting balance. Just as if I take my marketing hat off, I think about this all the time. Personalization is a good thing when it's done right. What you're receiving content that's specific to you, and so if you got a routine AI message that says, "Hey, you're due for a colonoscopy, or you're due, have an office, you're due to reach out to this person." In theory, that's a good thing, right? But
Hmm.
it's so tricky to find that line. You don't want to like go to that person and say like, you know, their specific condition. So I love hearing how everybody is, well, A, remaining compliant, but B, just trying to find ways to provide value while not, you know, breaking any laws or, you know, whatever you want to call it. So that's interesting.
Yeah,
Um,
I think it even goes to, a lot of times we talk about like, if we do talk to somebody about AI, we talk to a leader, and really the first question we have is, why are you interested in AI? What are you looking for AI to solve? It's not just that. And then sometimes you get people to kind of take a step back and go, well, let me think about it.
oh, I've just heard
Sometimes
it a million times. So I want
yeah,
to,
it's
you
like
know,
sometimes like, oh well, I hear that's where the puck is headed, so it seems like we should adopt. It's like, okay, yeah, it's headed, and yeah, it's exponential, it's growing, but at the end of the day, what is the problem that's being solved? Whether we use AI or not, if you go from patients were waiting 20 minutes on hold, or you're scheduling people inaccurately, people are not having their insurance verified, and we can solve that without AI or with AI, whoever can get it done, whichever way, just solving the problem is the number one thing.
absolutely.
Same with like yeah, you can use AI, I think, but if it's not, you don't have security, or you don't have thing, you don't have process set up the right way, it doesn't matter. It's just about solving the problem, and that's in our specific healthcare front office operations, and I think it's for everything. Wherever there are problems or wherever we're innovating, it's, I think it's very important to always think, is it that we're just adopting AI because it's very exciting? Or do we have a clear understanding what the problem is, or what challenges that we're trying to solve, and the way we're wanting to solve it?
AI for AI's sake is a lose-lose situation, right? You're just going to spend time and waste money. So it's great to have that North Star before implementing something like that. I'm curious if you have any wins or success stories that you could share. Obviously, don't drop names if you can, or organizations, but I'm curious if you saw a clinic or something that was struggling, you know, really, really bad. And after implementing, you got, you know, implementing third way, maybe they saw some growth or efficiencies. Just curious if there's anything that stands out like that from a win standpoint.
Yeah. So I'll put a shameless plug. We have a couple case studies on the website. One of them is, little over 30 doctors at an organization in multiple locations, and they had an internal call center, and then also an external call center that, like medical records vendor they had worked with, and they were having a lot of errors with the current ones they worked with, and it's caused a lot of administrative burden on their in-house team. They're having a lot of difficulty trying to keep people in their internal call center. Um, they piloted with us, which I would advocate anyone to be able to do. So you start with one or two locations that could maybe really use some help with getting calls answered, and then eventually we become their centralized call center, and a virtual front office. So in working with us, they've been able to reduce the amount that they are spending on these patient access operations by 35%. And then they've seen 11% more visits total. So they filled up their calendar, being able to see more patients. So I think the ideal state for anybody in operations is, hey, I want to do more for less. And so to be able to kind of put a stamp that we've been able to do that while improving the patient experience, scheduling more people to get their annual wellness visits. We've been ecstatic about it. I'm happy to be able to share. And yeah, one thing that whenever I first joined the company, I remember our chief product officer told me, yeah, I've worked for a couple different healthcare organizations, and this one, my wife had shared with me, I can really understand what you're doing. So it's kind of cool. It's not just like this very specific tech thing. You can just plainly share, and I feel that same way when I am able to share case studies. Like, it's pretty clear what we're able to do, and kind of point to the impact. Yeah, it's now easier for this organization that we work with, for their patients to call in and talk to someone on the phone, get their question answered, and for the organization to, see a business case come to life.
It's a very tangible results. You can clearly
Mhm.
see, yes, more people are getting booked, or it's a better experience just because there's less delays, whatever it may be. It's very tangible. You can feel it almost immediately, I would assume, or at least once it's like dialed in. Of course, there's always tweaks and stuff like that. One of the things that I found interesting is I was, again, doing some research. I believe you guys talk a lot about patient experience and use that as a metric. And I think it was like you guys have a 4.8 out of 5 in patient satisfaction scores, something along those lines. So I'm curious how involved that metric or that discussion is in your guys' operations and in your product development. Is that something that's kind of always talked about in the ether at Third Way? Because
Hmm.
again, that's just a very clear, tangible result that you can measure. That I think everybody's gonna be like, oh, my experience, me was a 4.8 out of 5. I'll take that every time, right? So
Right. Yeah. Yeah, like your patient satisfaction or your customer satisfaction survey, CSAT. So that's always going to be at the top of our analytics page of the technology platform. Or if you're looking at the account management team is looking at our current accounts, then you're looking at their CSAT score over the last month, or whatever it may be, quarter, month, week. So that's often is going to be tracked at the end of a conversation. Someone stays on the line and they answer a survey about their experience. Pretty straightforward. You're getting the results straight from the patients who had the experience. It's something that's always talked about, and then even in like SLAs, like when you're talking with a current client, they're able to see in the weekly status reports what the CSAT score is. So something that we're able to be transparent about, have data about, and not just be word of mouth about. Um, of like, oh, seems like patients are having a good time, or like, well, what are you hearing from your patients? You can have real data on how someone's patients are saying this is what my experience was.
can't fight the data. That's always great to have in your back pocket. Very, very, very cool. All right, so I want to do a quick pivot here and just kind of talk about the future, what AI-driven growth looks like, how you build for scale, and things like that. So I'm curious how you and Third Way are scaling the adoption of these AI tools, and what it looks like for a large system or somebody with multiple clinics. What do these conversations sound like at the enterprise level?
Yeah, great question. Uh, Sometimes it's interesting as to how in the weeds enterprise level are. Like some they could pinpoint specific locations or specific specialties within a large multi-specialty group that are struggling. Um, Even at the enterprise level, I think that statement I referenced earlier of ever since COVID, we haven't been able to staff seriously. Probably twice a week we hear that at the enterprise level.
I'm sure. Yeah.
Which means it's just getting relayed from the clinic managers to your regional operations directors to your VP of operations, all the way to COO going, yeah, something happened after COVID. I don't know if people want to work remotely a lot more or if they're able to just job hop more, but like getting a team that you're in there and they've worked many years. I mean, it's not an easy job answering the phones and working a front desk. Um, so that's often been the case. And then also just, you know, trying to figure out the different priorities and where people are for healthcare specifically. Your EHR, so your electronic health record system, is vast, is extremely important. So you catch somebody that's going through an EHR migration, it's like, hey, hats off to you. Good luck here as you go through that. It's a really huge adjustment. Often you're not going to be making other changes, as that's a massive change. And we'll talk in a few weeks, or no, not few, but maybe like a few months.
Yeah.
And then yeah, at the enterprise level, you're going to talk to somebody. Oh yeah, this is interesting. This is solve a problem. Okay, talk to our director of patient access. Learn a lot more about currently our internal call center, our external call center, maybe the AI tools we adopted. Um, the larger you get, the more complex you're going to get with different pilots that they are trialing other tech vendors or maybe other third party partners they're working with, and then you're going to have a much larger IT team that you're going to need to speak with. And so I think with anything, you're going to have longer sales cycles with enterprise. You're going to have more in-depth conversations, but it's been very interesting to still hear the on-the-ground pains of turnovers, or even like, hey, we've been hearing our doctors want to see more patients, specifically for specialty practices, orthopedics or dermatologists. They want to see as many patients as they can. And something that could get all the way up to the enterprise level. Yeah, I got a couple clinics that we got some unhappy doctors that are saying, what happened? I was seeing, 12 patients a day last year. Now I'm only seeing 6. And what can I do? What's going on here? Why isn't my schedule being filled up? So
cool, good stuff. So along those same lines of scaling adoption, I'm curious from your perspective as in your role, is there a mindset or even like a mantra or anything like that that you kind of use to harness yourself and your North Star when you're going into these conversations? Is it, again, the data that you have behind you? Is it something that you hear them talk about, or is it just like you kind of psych yourself up and like before a game or something like that? What is your mindset? How do you approach these and get the most out of them?
really good question. I think in general, you always want to say, oh, how can I put myself in someone else's shoes?
Sure.
And so the further along you get speaking with somebody, the more you can imagine what would it be like to be in their shoes. But at the very beginning of a conversation, I think it's, hey, tell me about how things are currently going on, and let me have a very clear understanding. And then the second time we talk, I think instead of psyching yourself up, it's often just the very first slide is very simple. Here's what we heard from you. Bullet out what we had heard. Did we miss anything? Did we get anything wrong? Is there anything else we should add to this before we show you a demo of our product? And then it's like, why should we show you a demo of appointment reminders or online self-scheduling if that's something that you aren't interested about? Well, let's just demo the aspects that you do care about. So let's all ground ourselves here and what's your actual challenge? Another really cool analysis that my CEO, he posted about on LinkedIn, analyzed the 65 conversations we had with the enterprise level COOs, CEOs about what we've heard that they're actually the top challenges that they're looking to solve. And so it was broken out. Number 1 was staff turnover. Number 2 is cost pressures. And then number 3, service quality. So even me, let's say like the first conversation I'm having with somebody is, hey, typically these are the first 3 we've been hearing. Which one resonates for you? And to kind of have this evolution of analyzing conversations we really did have. Oh, these are the top 3. And then using that to say, this is what we're hearing from other leaders. Has this been your experience? Has just made us, I feel like, speak their language. And the more you can be in the mindset of how a leader is thinking and, okay, what are all the different priorities that they have and where does patient access operations actually land for them? It helps you have meaningful conversations and meetings that are worth the 30 to 60 minutes and not just a waste of people's time.
I'm gonna have to check out that post. That sounds very interesting. It's great when you can go into it and say, I know most people are going through this. What about you? What resonates with you? I think that leads to a great conversation. That's great. All right, last question, just kind of to wrap things up. Let's look ahead. What does healthcare operations look like 5 years from now? I know you didn't want to say never in terms of a fully AI office, but I'm curious as to what you think will be different 5 years from now versus what you're seeing today.
Yeah, I mean, I have a friend in Los Angeles here. He's built a company it's like, a therapist in your pocket, essentially. And it's been interesting. It's like you speak to some mental health professionals, like, oh, that would be awesome. I can continue to stay engaged. Could I customize it for like each patient, and they could be able to ask questions, and then we still meet. Because I then talk to some that are they kind of hate what I'm doing. They don't like it's going to completely take their job. It'll be interesting to see how much patients adopt tools like that. They're only going to become more of them. It will be interesting to see truly exponential. Something I've thought about is, gosh, let's say 50 years from now, is it going to be funny if or 60, I don't know when it's going to be, but let's say I talk to my grandkids and it's like, Yeah, back in my day, I had to call. We had to talk to a human on the other line, and then we had to wait a long time. I'm like, what? Oh no, we always just talk to the AI. Or yeah, I had to drive into the doctor's office, and we had to have a human check stuff. Oh, what? I just step into the scanner, and then it tells me everything that you need. Who
Yeah.
knows? Who knows where it'll go? I think I could confidently say we're always going to need humans. Always, and people like there's a human touch that's going to need to be there. Um, Talked to a buddy just yesterday, and he simultaneously showed me a song that he created fully with AI, and then he told me, I think the way AI is going to develop, though, all it's going to do is really define what exactly the human touch is, because everybody talks about the human touch, but
Yep.
we're going to get a clear definition of what that means when there's going to be all these things that AI can do that we thought only humans could do. So I think only time will tell.
You're 100% right. I think all of our, BS meters are going to be dialed in into, yep, this is AI, this is human. It's going to be super, super refined. And I think it already is, but it's just going to get even more so.
Yeah, and I think it's like one of those things where sometimes people, like you don't even if someone gave you the right answer, you kind of want to hear it from maybe the right person, or it's like, sure, maybe I can go and I can search and AI can give me the answer, but I'd rather just go in and talk to somebody. Even
Yep.
now, yeah, if I have like a bot that might be or a chat bot that could get me my answer, I'm gonna go chat with a human because I
Yep.
know like as of still in 2025, I'd rather just chat with another human on the other line. Um,
I do that all the time still too. It's case dependent, but sometimes it's like I'm frustrated. Just give me someone who's going to tell me my answer right away.
Yeah, and I think with marketing or we talk about sales, things like that, I only think in-person events and uh, what will become more important. I think with COVID, it was really interesting to think about big consulting firms. Used to be, consultants, they're on the road Monday through Thursday. They're in person, they're working at their client site. And then after COVID, uh, all these companies saw, look how much money we can save. We're not paying for these hotels and flights. Let's just have all
Yep.
these consultants work remotely. And now you're seeing people are going back in person because they can't tell if it's an AI for them or what. And I think
Yeah.
you're going to have these back going back to if you need to sell or you need to really, I need to just kind of vet if I trust this person. It's going to be back into having the dinners, having the come in and closing the door and standing on a whiteboard, so problem solving together more.
There's never going to be a replacement for a good old handshake and looking someone in the eye. That's
Agree.
never going to be
Agree.
replaced. Yeah. Very cool. All right. So we're getting towards the end here, Will. I want to throw a 5 rapid fire questions for you for
All
us to
right.
kind of have a little fun. So, Genie in a bottle grants you a no cost, fully implemented automated system. What is that system? What does it look like?
Laundry.
Uh, I like that. I feel you there.
Laundry. Yeah. I'm just gonna stick with that. It's rapid fire. First that came to mind.
All right. Perfect. What is a pitch in your career that you've been a part of that you'll never forget?
Pitch that I've been a part of. I'll never forget. I think going on site and meeting a client for the first time, definitely will never forget that. And you have like both this experience where I got to interact with some doctors, and then at the end getting to go interact with the C-suite all in one day. So getting to have like the on the ground feedback, and then getting to have the where executive decisions are made, um, and also walking in and like your patients are around and just kind of being from that external vendor and getting people to see, yeah, I'm the name that was on the emails from the first time.
Okay. Yeah.
Um, and then getting to be in person. And again, kind of have that sitting in the boardroom, talking face to face with people and being zoomed out from all of that emails and being able to answer questions. I think the biggest learning from that was how much you can have like a printed out material, but when it comes down to it's the data to be able to make decisions. And that's like where we spent a bunch of our time. And it felt good to have stayed up late, making sure you get the data correct, and that lead to not just like you flip over it and actually, oh, that graph we put in there, and what we were talking about led to a large chunk of the discussion, and ultimately the deal working. Kind of felt good that your time wasn't wasted.
Nice. Sounds like a fully immersive experience, and you come out with it with a W and some learnings. That sounds like a good one for sure.
Yeah,
Awesome. Cool. When we originally connected, you told me you have I think it was a degree in mechanical engineering, right? So
correct.
I'm curious, what's one thing that you would love to just get your hands on, peek under the hood, meddle around with, whatever it might be?
So I want to talk to someone who designs roller coasters and engineers that are in roller coasters. If I had a day at a big theme park and you could tell me how they built, oh gosh, not the Millennium, what is it? The Millennium Force at Cedar Point. I think
Oh,
probably the
yeah.
greatest roller coaster I've been on. Yeah, just like talk me through the initial idea, and then you're making the CAD, and then you talk to other engineers. Look at an immersive day, and then you get a ride at the end. That'd be an awesome day.
I like that. That would be very cool to see, especially with how sophisticated they're getting nowadays. There's a lot to them.
Yeah.
Very cool. All right, Missouri barbecue or LA tacos?
I like to.
Gonna get you in trouble with the people back home?
Casey
Or-
barbecue, Casey barbecue. I'm just thinking of like ribs falling off the bone and brisket,
Yeah.
and a post game getting to just have that barbecue. I think that's it more than like the tacos. It's nice, but the top satisfaction level is the Casey barbecue.
All right. Nice, nice.
Yeah.
All right. And also, you told me you're a baseball guy. So if you're in the majors right now, what would your walk-up song be?
Hindsight by Audion.
Okay.
It's probably not a well-known artist. There's no lyrics in the song, but if anybody goes and listens to that, send me a message on LinkedIn. It's a favorite song.
Just walk up, get the vibes right, and then go hit a home run.
That's right. That's right.
Awesome. Well, Will, that was awesome. I appreciate all of that. We're at the open forum spot here, so I just want to see if there's anything that maybe you're passionate about that you want to share that we didn't discuss or anything like that. Just anything cool you want to call out?
Uh no, I don't. It's not like Hot Ones where I have a camera to look into and pitch anything for myself. I just want to say thanks, Kyle. I think what you're doing is very cool, and I love the under the hood question. So I'll just throw it back to you. What would you, even maybe if you're not an engineer yourself, but what would you love to have, like an immersive day? Look under the hood, how it's made or how it works.
You know that I got to start preparing answers to my own questions here. I'm a guy who loves the details of anything. So it doesn't matter the topic that you bring up to me. If you're going to tell me how something is made or why it works and things like that, I'm going to be all in, just because I think there's so much that we take for granted that just it all happens scientifically and we just don't know about it. So I don't have a great answer, but I am a sports guy. So
Okay.
I would love to, this isn't necessarily get my hands on the hood, but just kind of be a part of like team practice for a week, just to see how like an organization is run. You know what I'm saying? Like there's always like the themes and there's the coaching and there's so much, like you can get under the hood of an organization and just understand how they operate and what leads to wins. So I think that would be the cool thing for me to see how they operate. I'm a big Eagles fan, so to see
So
the
are you
Eagles
going
right
at night?
now.
You want to be you're a part of the tush push then. What are you, the QB? Are you, I'm assuming you're going to get the touchdown. Actually, I don't know if they practice it though. They're probably colliding heads. They just do it. Walk through
They
tush.
definitely practice it. They definitely practice it. They got to make sure they're getting that leverage. So I
Yeah,
wish I could say I was a part of it. I'll get two hands in there if I got it, if it leads to a
there we
touchdown.
go. There we go.
Well, awesome. Will, I really appreciate you taking the time to join me today. So everybody can check you out on LinkedIn. You're Will Hayes on there. Everybody can find you pretty easily. Third Way Health is also on LinkedIn, or you can just check them out at thirdway.health. They have their website up there. So Will, thank you again for joining me on the Brainiac Blueprint. This has been awesome. Do me a favor and look at the camera and say, "Stay brilliant, Brainiacs."
Stay brilliant, Brainiacs.
Awesome. Thanks so much, Will.
Yeah, thanks, Kyle. It was a ton of fun.
Cheers.